Ruto was talking about it, he's like, yeah, these people came to us with this deal. Really? The government is just a data processor. You get? It's holding data on behalf of us. We are the data owners.
Are people getting it wrong with the Kenya-US health deal? Like, are people getting it wrong when they say that our data, our health data, is being sold to the to the US, or are people actually on the money when it comes to this issue? Yeah.
So I don't know if you had seen it, but I actually wrote something about the health data pacts, and for me, what I was saying is that the pacts themselves don't really speak to, outrightly the sale of our data, but it's the ambiguity, the lack of clarity around those clauses that should protect our data, especially in the data pact, right? Not just the cooperation framework, right? That we should be wary of. And why I was saying that we should be wary of this is because if you look at the United States national security strategy and its approach to Africa, but also how it speaks about Black people and brown people when it's talking about security pacts with regard to Europe, then you start to understand some of the thinking behind what possibly will emerge from these kinds of pacts. First of all, if these pacts truly were for Africans, right, I'd say whereas the data pacts might have some similarities, there'd be vast differences between the pact that we sign as Kenya and the pact that we sign as Uganda and the pact that they sign as Lesotho, etc. But by and large, from what we're hearing, it looks like it's almost like a template that's just being shifted, like a PDF that's being sent to all of the country WhatsApp groups across Africa and told to sign, right? And that should tell you something, right? Like, so if this is the approach, where is the nuance beyond just changing the name? Kufuta jina uandike Uganda, ama uandike Lesotho, ama uandike, right? Like, where's the difference? Where are the needs of those particular communities and populations represented within the pacts that they are signing? Yeah. Secondly, just to go back to this thing about the security strategy, like the security strategy needs to be taken seriously, because this is not just like Trump, going out and posting a message on Truth Social or on X, where it can be said that ini maoni ya rais na huu rais ni ni wazimu. No, it is a strategy document for the United States, like meaning that it is policy that they will deal with Europe, especially when it comes to the NATO pact, with a certain posture that is that you guys need to fix this whole cultural, erasure. This what are they calling it? The great replacement theory that they are pushing, right? And who are the people who are pushing this great replacement theory? A lot of it is being funded and underpinned by a lot of big tech bros, like very strong, very powerful, very wealthy people within the digital, ecosystem. If that is how they look at people of African descent or people of Asian descent, anybody who does not look like them, then it stands to reason that the protection of our data rights will likely be an afterthought. And then secondly, whereas a lot of people have, pointed at the fact that, USAID, CDC, all of these people have held our data for years, and many of the things that have been happening with African health data, then why is it that Trump scrapped some of these organizations, unless now he's saying that the same methodology that they were using is what we are going to adopt, right? And secondly, because it was happening in the past, and it likely was, and our data was still being stolen, doesn't mean that we shouldn't speak about it today, right? If someone was stealing from you yesterday and you didn't know, and today you find out that now not only is it someone, it is the government that is stealing from you, should you say, because they stole from us yesterday, we should shut up about it? No, right?
Yeah.
Stealing is still stealing. Whether you were made aware of it yesterday or you were made aware of it today, it's important for us to start to ring the alarms. And especially now when these pacts have not been, solidified. I'd say, data pacts, that kind of cooperation will likely be things that we will see going forward, right? Because we are in an age where, data is an important part of any economic model, right? But it doesn't need to be the kind of pacts that are purely extractive, that benefit, benefit profit and large capital, right? Like if it is capital that you're extracting from me, what is it that you're giving me as a service? Where is my agency to say, no, you can take this data, but not this data? And there are models around the world for how these things can take place. That's why I was citing Estonia as an example. It's not a perfect model, but they have, like, an Estonian citizen has agency over the health data that they have. And they can tell a doctor, I don't want you to see this kind of data. I don't want you to see this, or you can have this. You understand?
Yeah.
And if data is currency, then shouldn't we also be able to hold currency? Currency shouldn't just be in the hands of the elite. That's feudalism, right? That's techno-feudalism. So that's what I'm trying to say. So you might not find like fingerprints of like an explicit line where it says our health data is going to be sold to Palantir or to Amazon or to Alphabet or whichever company, right? But it is the entire framework that we need to look at. Is this kind of pact going to benefit the citizen from which the data that we're looking at is going to be taken from, right? The data belongs, even by our own laws, right? Yeah. The government is just a data processor. You get? It's holding data on behalf of us. We are the data owners. So we must have, we must have some sort of say in what takes place. And that's really all I'm saying.
Yeah. I always say there's danger in ambiguity. DID. Danger.
Exactly.
No. DIA.
DIA.
In
Yeah.
like, if they're ambiguous, then like, for example, I saw the PS and the CS of health, Duale, saying, no, everything is good. You can trust us. We are professionals and all this. And I'm like, fine. Yeah, good. You are.
So let me give you actually another example of that whole rubric that they're using. You can trust us. We are government. We are responsible. You can come. If anything happens, you come and see me, right? In 2014, Kenya got into a deal with about 5 companies for the supply of medical equipment, the managed equipment leasing scheme, right? We were leasing medical equipment for the treatment or the diagnosis of various, diseases. Now, it always starts with virtue signaling. We have a problem. We are trying to we're proffering this solution, and this solution is important. And anybody who fights this solution is an enemy of the republic. This is exactly, the approach that was used during the managed equipment lease when they were trying to push the managed equipment leasing scheme. What came after that? What came after that were agreements that had been entered into before governors from various counties had their say, right? Before health committees had even looked at the managed equipment leasing scheme. So they already had an agreement, and then now they were trying to, retrofit all of the kind of processes that should have taken place so that, it passes the smell test legally. What then happened after that? They forced these things down the throats of county governments across the country, with the exception of Isaac Ruto's county. I don't know if you remember, in 2014, he was the only governor who didn't sign, right, that health agreement, and he was lambasted. He was lambasted, by I remember Duale at the time. He was a majority leader, and he was like, "Why are you so angry about this money? Hii pesa si ya mama yako," right? You
Remember
remember
that?
that? You remember that
Yeah,
soundbite,
yeah, yeah.
right? And what was happening on the ground was that county governments were receiving medical equipment that they did not have the capacity to use. There were, before you install a certain machine, you need the right kind of electricity, you need the right kind of housing. If you are installing machinery for an ICU unit, you need ICU nurses, right? Now, if you don't have ICU nurses and you have the equipment, that equipment is just as useful as a brick,
Yeah.
and we paid for all of that equipment. And another thing that they said is that no, the counties are not going to pay, right? But every year the counties were paying. Every year the counties were paying. Yeah. And this kind of virtue signaling followed by, ramming things down people's throats, and then now just, saying, it's a fait accompli, we might as well just move. This is a kind of methodology that, especially when it comes to these big projects, it's being normalized, right? It's important to ask the questions before everything is settled. And it's not out of a hatred for specific people in the regime. It's just out of an abundance of caution. An abundance of caution is good when you're dealing with things that are going to be that expensive, but more so when you're dealing with things that are going to be that expensive, and the people who are proffering the solutions are people who have shown themselves not to be trustworthy in these kinds of situations. So when people are questioning, they're right to question. Not only is it their right, they are right to question these things. So that's why I'm saying that these kinds of things, muwe macho, right? And it's not just investigative journalists, and thankfully, this is now something that is being owned by the public, right? It's not just the job of journalism to do this, it is everybody's job, right? Eternal
Everybody.
vigilance. Eternal
Yeah.
vigilance. That's what that means, The cost of freedom is eternal vigilance. It means that lazima uwe macho kila siku.
Yeah.
And if somebody is tired or slips up or is unable to do that, then somebody has to stand in the gap for them. That is how a society of values is built, when everybody recognizes that my responsibility is to do this, because if I don't do this, my people suffer and I suffer, right? That's how you build a culture of accountability. You don't build a culture of accountability by saying, well, we have the law, now follow the law, and then you go away and wait for people to follow the law. They'll never will if the incentive to follow the law is not enforced by vigilance. They never will.
Yeah. Yeah. And anything that Trump does is so transactional. Like
Exactly.
$1.6 billion just like that. I mean, no, there has to be something that he has to, to take in return. Like nothing is free.
Think about it this way, right? It's $1.6 billion. Sounds like a lot of money, right? But what is the valuation of OpenAI right now? Like when they were selling their shares and what have you, it was $500 billion. That is one artificial intelligence company. One company, right? So the economy around the digital economy, the AI economy, etc., is massive, right? To the extent that that money that is being given, and it's being given over a number of years, it's not being given upfront, right? That money is being broken down, and we also are paying our way. Now, interestingly, that's the part of the deal that I have the least problems with. I think that for us to have a healthcare system that is independent, we must also pay for it. We must own it. You get? That's a part of the agreement that I don't have a problem with. But being dazzled by $1.6 billion, but not looking at the person who's giving you, that is a pittance compared to the kind of money that they're spending in terms of war for, in the Ukraine or in Palestine or what have you. It's nothing, right? So we can't get dazzled by a few coins here to believe that the US has our interests at heart. It doesn't, right? It does not.
Yeah.
And then look at the kind of expertise that they're supposedly giving. Yes, the United States is fantastic at research, etc. But why is it that we don't think that that capacity to be able to build these systems exists internally? We have some
Yeah.
of the best trained doctors across Africa, not just doctors, but also epidemiologists, people who were in 2014, 2015, who had gone to West Africa to deal with the Ebola crisis, people who have been trained by looking at Marburg in Uganda, by looking at Ebola and its spread in the DRC, right? Those people are here. And even if they're not in Kenya, they're also in Uganda, they're also in the DRC, right? So if this expertise exists here, why aren't we then calling for that expertise? If we truly are an African, state, why aren't we not calling our African brothers and sisters to say, help us build this system? We can share this system with one another. Why is this not an initiative of the African Union to then now build the kind of healthcare and surveillance systems that are required across the continent, right? Why aren't they the ones who are driving this initiative? Remember, Ruto said Trump came to us. Now, we have had a plan. We have had a plan to streamline our healthcare system that predates these agreements, right? I've had a look at it. I think and to tie to Taifa Healthcare, the social health, SHA, etc.
Yeah.
So that plan exists. Maybe funding the plan is a problem, right? But is this the only way that we can do it? And are they the only partners, right? And it's not to say that the United States is an inherently bad partner. But don't just go there and take a deal that has been already crafted and you don't have any say and it's a take it or leave it deal. No. Have a backbone. That's all I'm saying.
Yeah, and have room for negotiation. You can't just especially that's weird. I didn't know that. So they came to us. That's suspicious. Like
go and look at the
you
sound bites that Ruto was when Ruto was talking about it. He's like, yeah, these people came to us with this deal. Really?
Something's up. But I guess we'll see when time goes by. But immediately I saw it, I was like, for me as a Pan-African, I've always been like, what is wrong with us Africans? Like, we are trusting the same America, that did the Tuskegee syphilis experiment. Until this day, there is little to no accountability to what happened in Tuskegee.
I want to say that we ought to be suspicious, but we also have to be realistic about, the state of the world and the state of affairs, and knowing that sometimes we will have to deal with bad people or people who do not have our interests at heart. This is just the nature of the world and of politics, right? We can try, as I've said, to look for the kinds of partners that most align with our values, most align with our goals, right? But we should know that there will come a day and a time that we will have to deal with people that are highly transactional, who possibly don't have our interests at heart. The question is, how do we deal with these people, right? How do we deal with them in a way that protects our interests and protects the way that, protects our futures, right? And of America writ large, America is not one thing. Yeah, and I think I've gone an even deeper appreciation for that now that I'm here. It's not one thing. There are very many people who believe differently than Trump does, right? And they are also having their own cultural crises around the world. So you also have to take into account that there's also a reckoning that's taking place here that could very well change the way the United States the West deals with Africa in the future. Maybe this is me being, cautiously optimistic, but I think there's also that to appreciate. And then finally, when we look at the way colonialism and neocolonialism has affected us, we also have to be careful not to stay in a posture of victimhood, right? Don't always say that these things will happen to us, right? And this is why I keep on talking about vigilance. You have to be careful that these things don't happen to us again. But the other side of vigilance is you also have to have a sense of agency, right? Like a sense of dignity, that I also have my own way and my own approach of dealing with things, and it might be different than what I see out there, but it is mine, right? And I will stand by it. For all of its shortcomings, an example of something like that is Ujamaa, right? When Nyerere was talking about, freedom and independence, and the challenge of independence being now that everybody is going to start looking at the state and not looking at African interests. In a sense, he was right. And then now applying Ujamaa inside his own borders, it then now gave our neighbors a completely different appreciation for the place of tribe in their cultural mix, as opposed to what happened here, right? And so, you think about, I was reading something about Bildad Kagia yesterday, and how Kenyatta was lambasting him for saying, you Kagia, you're always complaining, but look at you, you have nothing. We fought independence so that we can also own things, right? That wasn't why we fought for independence. And Kagia fighting for the prurient interest and being one of those people who exercised vigilance in his life was then demonized by the powers that be. And what I'm saying is, at a certain point in time, we also have to recognize that if there's a certain way in which we want to live, we have to stand up for that. We have to create the kind of future that we want to live in. Yeah? Because it's not going to be created for us, right? The values that we are hoping that will be reflected in our relationships with the United States, etc., are not going to come from them. They have to be reflected in how we move, right? So just bringing this back home, yeah, and to, I don't know if I'm jumping the gun, Orina, here, but to the conversation we're having in Kenya ahead of our elections, and this whole thing about Gen Z and that, I don't want to plug that I was writing about this, but I have written about this, right? What's happening is that the values of the state are showing you what the future is going to be. It's going to be largely dystopian. They are creating the kind of legal framework for an authoritarian approach to governance of Kenya. This is how I see it, right? Many of the laws that are being passed, many of the partners that they are choosing, look at all of that, and then you can see that there's and then also this whole proffering of, I'm the one with a solution, right? Like to have a leader who is almost messianic. It tells you that the reliance is not on they're looking at a pyramid in terms of their approach to how this country is led, that the solution can only come from up there. Yeah. But is this reflective of the values that are stated in our constitution? The constitution, in the first few lines, says that we gave this constitution to ourselves. Nobody gave it to us, meaning that we wrote it together. Yeah. And if that's a declaration of the future that we want to live in, what does that look like in terms of the way we approach our laws, the way we approach one another, the way we drive on our roads, the way we vote in our elections, the vigilance that we have in our election cycle, this thing of saying, oh, they are goons, and then saying, oh, no, like, what are we going to do? If they are goons, that are ruining the future that you want to live in, what are you going to do about those goons? You understand? Like, what are you going to do about those people who are continually interfering with this vision that we all signed up to? This is the time to say, this is what we are going to do. Because if we don't do anything and we complain about it, we'll be doomed to live in the future that is created by the people who are currently holding the instruments of power, who are currently, adjacent to power. You get?
Yeah.
In
Yeah.
other words, I am saying, if you want to live in a good country in Kenya, you have to say and declare very specifically. Don't be ambiguous about it. We're talking about ambiguity in the health pacts. Don't be ambiguous about the kind of country you want to live in. Say this is how this country should look, right? According to this document that we signed, this is how this country should look. This is how we want to go forward. And remember, even them, they say, power is never given, it is taken. You take that power. You understand? Take it. I'm saying this because, frankly, my time as a person who can chart the destiny of the country is very limited. I'm not in the majority. Yeah. And I'm not necessarily saying take it through violence. No. Right? What are the ideas that we are giving? How persuasive are these ideas? You have to go out and try and persuade people to do things. And there are certain things that tell me that this is starting to happen. There's a young man who is going to simplify the constitution and go around the country, right? And he's trying to make the constitution a part of our curriculum. That is him telling you, me, I want to live in a country where all of the children in our republic know what their rights are from the day that they enter school, right? There's another two people who, young guys who are this initiative called VAR, who are going around the country making sure that people get their voters cards. What they're actually saying is that I want to live in a country where young people appreciate that in order to change the political system, you have to vote. You get? So these are the kinds of declarations that we must make, and not just make them, but bring them into reality, like bring them into breathe life into them by doing the work that needs to be done. That is the difference between countries that live within neocolonial systems that accept that neocolonial system and countries that live within neocolonial systems that want to get out of these neocolonial systems. To me, I humbly submit.
Yeah, it's up to us.
Exactly.
It's really up to us to change. Like Michael Jackson said, take a look at yourself and then make that change. So, and speaking about voting, and I have a voting card, but I speak to Gen Zs almost every day.
Yeah.
And there's a reason why they're not getting the voting card the way we expected them to get. I mean, there's just jadedness going on. Because you know what they're saying? They're like, CTAB too. Their life will be stolen either way. So what do you say to that mentality that, like to them, they're just like, it's just going to be the way it has always been.
So there's...
Is there a story that you were like, I thank God that I left there alive?
Yeah. There was a time when we entered one of the buildings, and we were filming behind the police, and then one of the police shouted grenade, and we all we ran out of there, and indeed there was an exploded grenade, and we were packed in there, 20, 30 guys, cameras, guns, people being taken out of the building and being taken to safety.